Okay, welcome everybody. What we were working on up here is that this wasn't plugged in last night, so there's some concern about how the mic's going to work. We may have to switch along the way. I'm glad you're all here. I'm glad you took Saturday morning to come talk about Alzheimer's disease. Alzheimer's is a disease that...
Louder.
It's, you know, I'm glad you said that, thank you. It's really important that if you're going to come that you can really hear. Can you hear me back there now? Not really. How about that? Great, and if it changes along the way, just let me know, put up your hand or something like that, because again, I'm really glad you came. So Alzheimer's is a disease that robs people. Robs them of their memory, their personality, their capabilities. And we have hundreds of billions of neurons or nerve cells in our brain. And between those nerve cells, there's trillions, hundreds of trillions of connections. And what happens is that these nerve cells begin to dwindle and they die. Those connections go away. And literally what happens is there's a hole in the brain. You know, the memory's not there. There's aging that happens in the brain that's not normal, very, very fast. And in 2017, Alzheimer's disease was the most expensive disease in the US. Globally, it's thought to be one of the 2 or 3 most important conditions, medical conditions in the world, and very expensive in the US. But it's, you know, as important as that is, it's also important locally and in our families. I'll bet you some of you have a family member or a friend or spouse or a mother with Alzheimer's disease. If you do, raise your hand. Yes. So it really affects us. It really not only hits us globally and nationally, and it hits us at home. Introduce you to this woman. Her name is June Marie. In about 2000, she started having some difficulty with her memory. A few years later, she wasn't able to function at home. And she came to live with us. This is my mom, and you could bring a tear to my eyes as I talk about her. So, indeed, this lovely, delightful woman became demented. It was sad. And that word demented, it's not a derogatory term. I will define that as we go along, what demented means. But she was demented. She was also a little paranoid. She was a little bit belligerent at times. But she's still my mom. We loved her. And thanks to my family, my wife and my 5 kids, she lived with us until she died. This was just a few days before she died in 2009. She died of an infection, and that's really common in Alzheimer's disease. An overview of the talk today. We're going to look at the history, and I think you'll find the history of Alzheimer's disease very interesting. Then we're going to talk about what is dementia. What is it to be demented? And is somehow Alzheimer's dementia something different? We'll define that. We'll talk about the umbrella term of dementia and then how Alzheimer's fits underneath that. We'll look at the risk factors for Alzheimer's disease. And how do we make the diagnosis? What's the current treatment? And is there anything else we can do? Now this lecture is going to be kind of like high school AP biology. There's going to be some parts of it that are going to be complicated. Because this has, although all of you are going to go home with great information that you're going to be able to use, it can be a little bit complicated. These slides and this talk is going to be recorded, and it's going to be on my website, and that's drchrislink.com. So in a couple of weeks, if you're interested in coming back and looking for some of the information that I presented, you'll find it there. I'd like to introduce you to another woman. This is Augusta Dieter. In the 1890s, she started having difficulty in her kitchen and at home. She was beginning to lose her memory. She was having delusions and paranoia. And in 1906, after her death and autopsy, she was the first person ever diagnosed with Alzheimer's disease. What's interesting is that in 1906, Alzheimer's disease wasn't very common. Most people, in fact, the average man lived to about 47 years old. The average woman a few years less than that, actually. And the most common reason for dementia, believe this or not, was syphilis, which is a venereal disease that caused neurosyphilis, and we didn't have any medication to treat it. The second most common cause was a stroke, or strokes, or multiple strokes, like mini strokes. Those were the causes of dementia. And it was Dr. Alzheimer that sorted this out. Dr. Alzheimer admitted Augusta to Ehrenschloss. This is a hospital for the mentally ill and epileptic in Germany. It was commonly known there as the Castle of the Insane. In 1996, a researcher and physician went back and found his records, Dr. Alzheimer's records of the admission of this woman to that hospital. In the journal entry, he said this was a 55-year-old woman with memory loss, hallucinations, screaming hours in the night. Went on to describe the interview. "What is your name?" he said. "Augusta." "What is your husband's name?" "I believe Augusta," she said. "Where are you right now?" "Here and everywhere, here and now," she said. He reported that she would scream through the night, "Oh God, I've lost myself." Ich habe, anybody that speaks German, I think it's Ich habe mich verloren, is what she said. And indeed, we lose ourselves as we lose our memory, right? The tapestry that is our life gets pulled one thread at a time until it's threadbare and those memories are gone, the capabilities are less. It's indeed a sad. Now, Dr. Alzheimer's was a psychiatrist with a microscope, and on her death and autopsy, he found that her brain had shrunk by about a third. He found that there were plaques of amyloid and tangles. He didn't know why they were there, but he described them, he saw them for the first time in science. And just a few months later, he went to a prominent medical meeting in Zurich, Switzerland, and presented this data that he was proud of, that he thought was very important, new finding. They dismissed him. They thought he was insane. So in 1906, he found the information that's going to help us in one of the very most important diseases of the 21st century. And he was dismissed in 1906. The brain on the left is one like Augusta's may have looked like. It's shrunken. There's big grooves between the brain tissue. These are called the sulci. The tissue has gone away. This is another diagram, and on the left you can see the full thick brain and normal neurons of the healthy brain. On the right you can see the holes, the missing cells and tissue on the right, and on the inset on the right you can see the plaques that are the sticky proteins of amyloid that are between the neurons that disrupt the function of the brain, and the tangles that disrupt the inner function of the nerve cell. There are three pillars of Alzheimer's disease pathology. Number one is the amyloid plaques that are the sticky protein that aggregate, that clumps together between the nerve cells. Then there are these tangles called neurofibrillary tangles of this protein called tau. And this comes from a microtubule that's meant to actually bring materials and energy through the long nerve cells. But instead, these things tangle up and the nerve cell dies. Then there's inflammation, and this is a big key word in 2018. There's inflammation of these glial cells, these cells around the neurons, the nerve cells in the brain. And this triad, the plaques, the tangles, and the inflammation lead to nerve cell death. This is the pathology of Alzheimer's disease. Now, what's interesting is you see this big swath on the right there, the green swath. That's when dementia presents, typically after the age of 65, but not always. My mom started to become demented in her early 60s. But typically after the age of 65. But what's interesting now is we're seeing biomarkers like proteins in the cerebral spinal fluid that we can check. Some testing, I'll talk about proteins in the blood. Special scans, MRI scans and CT scans, where we can start to see the pathology of Alzheimer's disease 20 years before. Dr. Tanzi, Rudolph Tanzi, is a researcher from Harvard, and he discovered the Alzheimer precursor protein as a student at Harvard in the mid-1980s. He's still there, fabulous guy. And he said that everyone starts to develop these plaques by the age of 40 in their brain. So what is dementia? So dementia is the global term for cognitive mental decline, memory, organization, speaking, and calculating. Happens for different reasons. Common reasons are vascular, that is strokes or mini strokes. Another one is called frontotemporal because it affects the frontal part of the brain. Another is called Lewy body dementia, and some of you have probably heard about that. This is a dementia that not only does it affect memory, but it affects movement like in Parkinson's. But most importantly is Alzheimer's. 70% of dementia is Alzheimer's disease. That's why it's so important. These are self-portraits. This is William Utermohlen. He was a famous artist in the U.S. Maybe some of you know of him. And as he developed Alzheimer's in the 1990s, his self-portrait changed, as you can see. And indeed, he lost himself, it seems. So the beauty of the person, the soul, is still there. But the memory, the capabilities, they're diminished. Alzheimer's disease is the 6th leading cause of death in the U.S., and some researchers now believe it's the 3rd leading cause of death in the U.S. It is more than breast cancer and prostate cancer combined. 5.4 million Americans are living with Alzheimer's disease, and there's another 30 million of us out there that have significant plaques and tangles, and we have not manifested the clinical signs of Alzheimer's disease yet. This is a big problem in the U.S. 16 million at least by 2050. 1 in 3 older adults will die of Alzheimer's disease. Did you have any idea that this disease was so important, so affected so many people? I really learned that in the last few years, but when I saw all of those hands of yours go up, it certainly corroborates that. Women make up 65% of the people with Alzheimer's disease, 60% of the caregivers. Dr. Nick Fox, a professor of neurology at the University College of London, said 1 in 3 people in this room will develop Alzheimer's disease. 1 in 2 will take care of someone. And we as a society are sleepwalking into this epidemic of the 21st century. Alzheimer's disease, according to the Alzheimer's Association 2017, is the only leading cause of death that cannot be prevented, slowed, or cured. Leading researchers say that it is the most expensive disease in America. Well, let's talk about the funding, the research funding behind it. You think a disease that we spend $260 billion on would have a lot of research funding. Well, it has 5 to 10 times less research funding than cancer. The U.S. spends more on popcorn, Viagra, and anti-aging creams than we do on Alzheimer's research. $1.4 billion was spent in 2017. That's a good chunk of money, but it doesn't compare to the $260 billion. In the mid-1990s, when the HIV epidemic was at its height, we spent $26 billion annually on HIV research, $26 billion annually, and we made a difference because we came up with high-activity retroviral therapy, heart therapy, and we've significantly diminished the death rate from HIV such that it's now a chronic disease and not a death sentence like it was. Alzheimer's disease, again, according to the Alzheimer's Association, is a progressive neurodegenerative brain disease, that is always fatal. The average life expectancy is 10 years. There are 0 cures. This is the natural history. Symptoms begin over the first couple of years. Soon thereafter, the person is taken to their physician and the diagnosis is made. We'll talk about how that's done in a minute. A hallmark of Alzheimer's disease is the loss of memory and the loss of independent function. So you're not able to do everything you need. Cook, clean, drive, etc., do your books. You lose independence, as my mother did. You have some behavioral problems. Maybe problems with sleep, maybe problems with wandering in the years 5, 6, 7, something like that. Often nursing home placement. And then death. And these people die of infection typically. My mother died of meningitis from an ear infection, but they die of urinary tract infections and pneumonias and bed sores. Let's talk about the medications. This is the most common medication used in Alzheimer's. It's called Aricept. It was developed and released in 1996. If you look at the slope of the condition, Alzheimer's disease, in a person on Aricept, it's very likely that they're going to get a little bit better for a few months after we give it to them. But their progression does not change. The progression of the disease, the course of the disease does not change. The second most common drug is Memantine, or Namenda. Again, there is no evidence that it reverses the downward spiral. So let's talk about the research for the silver bullet we're looking for in Alzheimer's disease. Between 2000 and 2017, 250 drugs were tested. Only one has made it to the market. They're all looking primarily at trying to decrease the accumulation of that amyloid plaque, or try to get rid of that amyloid plaque. The only drug approved was that Namenda, and we know Namenda doesn't change the course of disease. So we are hopeful for a silver bullet in Alzheimer's disease. There's great research going on. I'll talk a little bit about that as we go, but we're not holding our breath. And what I've presented to you, some of this history and some of the demographics and the epidemiology and pathology, these things we've just talked about, it's pretty bad news. It's pretty depressing, really. The rest of the talk won't be so bad. So let's talk about the silver buckshot approach instead, which does make a difference. Which does make a difference in the course of Alzheimer's disease in 2018, and there is data to prove it, and I'm going to show it to you. The therapeutic program of the silver bullet is a brain-healthy diet, avoid brain toxins, brain-boosting lifestyle, optimize labs and replace hormones. My mother had a hysterectomy at age 32. They took out her uterus, they took out her ovaries. This was in, I guess, about 1971. She had no estrogen from the time she was, a vital woman until the time she died. There's no question that early removal of ovaries enhances or increases or the likelihood of Alzheimer's in women. Absolutely. If you've had a hysterectomy without your ovaries removed before the age of 40, the likelihood of Alzheimer's is significantly increased. We're going to talk about some supplements. And I put the supplements last because, yes, I think they can be helpful, but it is not the pillars on how we can get this disease back. This is a groundbreaking article that was published in 2014. The name of the article is A Reversal of Cognitive Decline, a Novel Therapeutic Approach by Dr. Bredesen. I think he may receive the Nobel Prize for this. If I was voting, I would definitely recommend it. So he put together a novel, comprehensive, personalized approach for a group of people, where he used multiple modalities, and he found 10 people. And out of those 10 people with Alzheimer's in 2012 and 2013 and 14, when he did this research, 9 out of 10 of them improved. One did not. 9 out of 10. Now that's a whole lot different than what the Alzheimer's Association tells us is the natural progression of Alzheimer's disease. Let's look at some of the modifiable risk factors in Alzheimer's disease. Nutrition, physical activity, sleep, relaxation, education, and brain activity. lab abnormalities, and that's the personalized approach. If you get the labs right for that individual, that's important. Hormone loss, that's again personalized. If a person is low in hormones, we need to look at that. Toxic exposures, infections, head trauma, and last, I'm going to say supplementation. People that have had head trauma clearly have an increased risk of Alzheimer's disease. These are the non-modifiable. Age, gender, women, we've talked about that. Family history like mine, and genetics. Only 1.6%, just less than 2% of people at age 65 have Alzheimer's disease. By 75, 20% have Alzheimer's disease. By 85, 40%, and some researchers say that it's closer to 50% of people 85 years of age or older. Now, when we get older, we lose some muscle too. You've seen that and maybe recognize it in yourself or in family members. At age 25, a thick, strong, muscular thigh. At age 50, maybe not quite so muscular. And at age 70, less so, right? Not everybody needs to look like this at age 70, though. We know that with diet, lifestyle, exercise, sleep, hormones, and supplements, at age 70, you can have some really functional, intact musculature. It's not terribly surprising that the brain may respond to these same sort of things. It indeed is a human tissue, like muscle. These are non-modifiable risk factors. These are the genetics. And these are the genetics behind early onset Alzheimer's disease. You may have heard of this. A few months ago there was a presentation on 60 Minutes about a group of Colombian families that have Alzheimer's in their 30s and 40s. We've learned from these people. It's unfortunate. They know it because it is a fully penetrant disease. That means if they have the genetics, they're going to get it. And if their mom had it or their dad had it, they've got a 50% chance of getting it. Right? So those families know it for sure. And we've learned from those families because we've learned about some of the things. We've learned about amyloid precursor protein, the APP. There's some genetic abnormalities of that. There's genetic abnormalities of another protein called presenilin 1 and 2. These people usually get Alzheimer's in their 40s. But it's only 5% of Alzheimer's disease. So it's important. We want to help these families. It's important from the research standpoint, but it's only 5%. There's another genetic concern, and this is the ApoE4 gene and related protein. This causes late onset Alzheimer's disease. And it's associated with 65% of Alzheimer's disease. So 2/3 of people with Alzheimer's disease have this gene. 1 in 4 of you in this room have this gene. 1 in 4 of people in this room have the ApoE4 gene. If you have one of the genes, that is you got it from mom or dad and you have one gene, that's called heterozygous, and you have a 4 times or 400% increased risk of Alzheimer's disease. We can test for this. And I think there are some things we can do for it too. If you get this ApoE4 gene from mom and dad, and you have both of them, you have a 10 times increased risk of Alzheimer's disease. Between a 50 and 90% risk of Alzheimer's disease during your lifetime if you have homozygous. About 1 in 10 people in this room have that. That's a picture of the protein that is made from this gene, the apolipoprotein. And this protein was important, and it was much more common 800,000 years ago than it is now, because it really helped human beings fight infection. So when they were in the savannas and plains of Africa, and there was high likelihood of infection from injury and from who knows what in their life, this helped them survive. But it decreases longevity. It increases the likelihood of amyloid, and it decreases the clearance of amyloid. So that's what this ApoE protein does. Now, everybody has an ApoE protein. It comes in the 2 variety, the 3 variety, and the 4. It's the 4 that's the dangerous one. What this apolipoprotein does, this protein in the blood, is it transports cholesterol and it transports vitamins like vitamin E and D and K. So it's important. Everybody has it. There's a term, and this is the AP biology here, there's a term called antagonistic pleiotropy, that there are certain genetics that we have that help us survive early and sacrifice long life. They help people survive early, but they sacrifice long life. So back to the modifiable risk factors. These are important. Nutrition, activity, sleep. I'm going to say sleep again because it's really vital. That's why we started this at 9 o'clock this morning. For my sleep. Relaxation, brain activity, optimize labs, replace hormones, reduce toxins, eliminate infections, supplementation. So many of you, I'll bet, 50 and older, have had a colonoscopy. Dr. Bredesen has coined the term cognoscopy. He said we should start to be thinking early on, because we know Alzheimer's disease problems start 20 years earlier, that we should be thinking about looking at this earlier. So at about 40 years of age, we should be looking at these risk factors that I just put up. Am I exercising enough? Am I eating the right sort of nutrition? Am I keeping my brain active? Do I have the ApoE4 gene? What's my family history? Maybe even have a cognitive assessment to know where you're at now. And then I'll show you things like the MRIs and PET scans that are going to be more and more available. They'll tell us how our brain is aging. Now, like cancer and diabetes and heart disease, we look to make that diagnosis before there's significant pathology, right? Before the person's had the heart attack or before the cancer is spread. We have to start thinking about Alzheimer's disease in this way. Before clinically present at age 65 or 70 or 75, where memory starts to be impaired. These are some of the important blood tests that we look at. Cholesterol, if it's too high. Blood glucose, and average blood glucose with the hemoglobin A1C is really important. CRP is an inflammation marker. We've talked about how inflammation is so vital in that triad of pathology. Homocysteine is another blood marker. The vitamins B, the vitamin C and D and E. Omega-3 index. Now we can measure the omega-3, those healthy oils that come from fish in our bloodstream. And we can measure the hormones, estrogen and progesterone, thyroid, testosterone. We can measure minerals like magnesium and zinc and copper and others. This was an article in 2018, January, so just about 6 weeks ago this article came out. And they found a blood test now that can look at the amyloid byproducts in the blood, and when they tested that against MRI scans and cerebral spinal fluid testing, that it was a good indicator of early Alzheimer's predisposition versus the disease. So a way that we're going to be able to test it early. Blood tests are different than drugs. Drugs take 5 or 10 years to come to the market. Blood tests don't take that long because it's not a risk to get a blood test done. As long as we know it works and it's valid and has veracity to its data, then we can usually get that blood test within a year or so. We likely will have. And then cognitive testing. In your doctor's office, we can do a mini mental status exam. It's a 30-point pencil and paper test. It takes about 10 minutes. The one that we use more commonly now is called the Montreal Cognitive Assessment Test, or MOCA. It also is about 10 minutes. It's a pencil and paper. It's out of 30. If you have a 25 to 30, your brain's functioning good. You're able to calculate and remember and draw well, have a good spatial orientation. But if it's less than 25, you have mild cognitive impairment. And as it gets to 17 or 18, as it goes down, that's an indication of Alzheimer's disease, particularly if you have loss of function, if you're not able to fully function in your home. And there's another test that we've just added to my clinic, the Integrative Clinic, is the CNS Vital Sign test. And this is a computer-based test. It takes about 30 minutes. I'll talk a little bit more about this. But this is for people that have subjective. They're just starting to feel like they're not remembering things or calculating, or maybe have a little trouble remembering where something's at in the, in their community. And those people can do this test because it's more sophisticated and more sensitive to small changes. This is an example of the pencil and paper MoCA, the Montreal Cognitive. And there's a letter and number line drawing test on the left. There's a test to draw a cube in the middle, and there's a test on the right to draw a clock, and they ask you to draw the clock at 10 minutes after 11. And then down below, and I'm not going to show the whole test, but here's name these animals. We're going to ask you to remember 5 words. We're going to ask you to subtract some numbers, those kind of things, and then we get the total number score of 30 or less, depending on how you find. So this person has some cognitive decline. You can see that their 10 minutes after 11 is okay, but the clock isn't quite right. Some numbers are missing. You can see that this kind of more complicated line drawing test, where it's sequential between the letters and the numbers, isn't quite right. And you can see the cube, though it's not bad, isn't quite right. You can see that there's some issues here. And I mentioned about the CNS Vital Signs, how it's a more sophisticated, sensitive test, allows us to get a cognitive baseline in people that are concerned about their cognitive function. This may be part of the cognoscopy. Remember, we're coining that word, the cognoscopy, to say, how are you at age 40 or 50? And these are some of the imaging tests that we do. These have made amazing strides. Our ability to image the human body and brain has really remarkably improved in the last decade. So this is an MRI scan, and on the left is a healthy full brain. In particular, they're looking for shrinkage of the brain and shrinkage of particular areas. In the central portion of the brain, there's this structure called the hippocampus. It's named after a seahorse. And it's in the central part of the brain, the older part of the brain, that helps us store and retrieve memory. And on this scan here over on the right, where you see the couple of arrows, that hippocampus is shrunk down. This is where Alzheimer's disease starts, at our memory center. And then, with the inflammation and this whole kind of cascade of things that happens in Alzheimer's disease, it spreads like a wildfire through the rest of our brain. The frontal part, where we have executive function, and other parts in regards to memory and location and things like that. So that brain is quite different on the right. This is a PET scan, a positron emission tomography test, and this is looking at glucose utilization. The brain is about 5% of the weight of the body, but uses 25% of the energy, all of the glucose. And here on the left is a brain that's bright hot and orange with a lot of use of glucose. But on the right, the Alzheimer's brain is cold. It's not functioning very well. It's not using energy very well at all. There's a glucose utilization problem in the brain. There's no question about that. There are some researchers now, they're calling Alzheimer's diabetes type 3. Diabetes type 3. This is a very new scan, and this time the Alzheimer's disease brain is on the left, because this biomarker, this radio-labeled marker, actually can attach to amyloid. And on that brain on the left, there is a lot of amyloid. The red and orange is the amyloid that is taking up that radio tracer that we can see on the PET scan. So back to the 3 pillars of Alzheimer's pathology. The plaques between the nerve cells, those tangles inside the nerve cells that disrupt the energy function inside that nerve cell, and the inflammation that creates this wildfire through the brain, and nerve cell death. And again, this is the therapeutic program. Brain healthy diet, avoid toxins, boosting lifestyle, optimize labs, personalize hormones, supplement the brain when needed. Yes. Thank you for that question. I will. And in just a minute, you ask an important question, and I've got a slide for that in just a minute. And then at the end, we're going to have time for all of your questions. As long as you want, I'll be glad to answer your questions. So that Dr. Rudolph Tanzi, that young person in the mid-'80s as a student at Harvard, discovered this protein, the amyloid precursor protein. And in the center, you can see this long blue protein there, and it sticks in and outside of cells, both the nerve cells and other cells in the body. And enzymes are like scissors. They're protein scissors that can break that protein down. And if it's broken down as it is on the right side into 4 pieces, this is an evil quartet of fragments of that amyloid precursor protein that actually accelerates that brush fire into nerve cell death. But on the other side of this, if it's cleaved into just 2 pieces, these actually are trophic, and that word trophic means helps to build brain cells. So it's like a mountain. If we can do more things that take the protein to that dynamic duo that helps brain cells work better and grow more, we can grow brain cells now in our own brains. It's not like you're only born with so many and that's all you get. And we can stop doing the things on the right. And we know now that there are several things. And Dr. Bredesen, who I mentioned, who did that paper, has spent the last 20 years of his research looking at what things change it on the left and what things make it happen on the right. And things like a colorful diet, exercise, brain activity, sleep, proper hormones, slice it such that it goes to the dynamic duo instead of the evil quartet. And that's the silver buckshot approach. Okay? So these are the modifiable. We went through these. I want you to just continue to look at them. Nutrition, physical activity. We're going to talk about each one of those specifically here over the next few slides. The brain is hungry, uses 25% of the energy of our body, and it loves a colorful, nutrient-dense, anti-inflammatory diet. That's what it loves. This is a study called the Mind Diet Study. This was done at Rush Presbyterian Hospital in Chicago. And they followed people over a period of years, and they had a group that ate whole grains, colorful berries, plenty of beans, plenty of greens, poultry, nuts, other colorful vegetables, fish, and I'm going to just underline fish. Very important. And a little bit of red wine. And these people had a significant and substantial slowing of the cognitive decline. So if the brain was a muscle, it would stay strong. And that's what happened with this. So we know now in 2018 that we can use a healthy, nutrient-dense, colorful diet to improve our brain health as we age, especially if we start it young. But it doesn't mean that if you're a little bit older that it won't help. This is another study of the Mediterranean diet. 500 participants followed for 6.5 years. And the Mediterranean diet is that same diet, colorful, plenty of vegetables, beans and nuts and olive oil, those sorts of things. And the people that followed that had a significant decrease in their cognitive decline as measured by that clock drawing test I talked about. They did much better. So another study that really tells us that. So this is the sort of nutrition I'm talking about. The base of the pyramid is vegetables, beans and lentils, fruits, but less if you're a diabetic, meats and fish, nuts, lots of olive oil, few sweets and a little bit of wine if you choose to do that. So that's the diet that makes a difference on cognitive decline. Now, there is a more sophisticated diet, and it's called nutritional ketosis, and this has been looked at for brain function that's already declining. This is a little bit more challenging, a little bit more difficult. This is a low carbohydrate diet, but it's not the Atkins diet. It's not a cheeseburger and bacon. We're not talking about that kind of low carbohydrate diet. We're talking about a well-formulated low carbohydrate diet. So plenty of green leafy vegetables, cruciferous vegetables. Vegetables are the base of your pyramid. 70% of what you eat is colorful vegetables. You get rid of the glycemic, the high sugar foods, the starches and the juices and the potatoes. You try to remove things like herbicides and pesticides because these are toxins for the brain. And you go gluten and dairy free, and I'll talk to you about why that is on the next slide. You emphasize fat. And FATS is not a four-letter word anymore. It is absolutely important for the health of our brain. Healthy fats in the form of nuts and avocados and fish and olive oil. You eat fish frequently and healthy meats. This book was published by Dr. Perlmutter. He is a nationally regarded neurologist out of Florida. And this is about how grains increase the third pillar of Alzheimer's disease, inflammation in the brain. Okay, if we can turn down inflammation, we're going to stifle the progression of Alzheimer's. So in this diet, this nutritional ketotic diet, we cut the carbohydrates. You see, usually the base of the pyramid, right, is potatoes and rice and breads. You just cut those out. You know, those foods are nutrient poor, calorically rich. Let's get rid of the nutrient poor foods and let's get all of the nutrient rich foods for the brain. So this is what this nutritional ketosis diet looks like. With fats being one of the most important part of the caloric intake. Lots and lots of vegetables and fish. 25% of the calories are from protein. Lots of healthy fats, as I mentioned. Less carbohydrates. You don't see much in the way of potatoes and breads and cereals on there. And 70% of the volume of the food you eat comes from colorful, nutrient-dense vegetables. So that's what to eat. And in 2018, the science solidly supports that in regards to ways to improve your brain. The other thing that we know really makes a difference is when you eat. And many of you probably have not heard this. There's a term now in medicine called time-restricted eating. And it has remarkable benefits for human beings. What we look to do is to fast overnight for 13 hours because that lowers inflammation, cholesterol, blood sugar. And to fast 3 hours before bed. So if you had your first meal, for example, at 8 a.m., you would have your last meal at 7 p.m. This is really not that difficult, and it's immensely healthy for you. And I'll just say this, a recent study in the Journal of the American Medical Association that looked at oncology, breast cancer, when they did this with women who had breast cancer, they followed a group of women for about 10 years. They had half the women do the time-restricted eating. They didn't change their diet at all. 13 hours of fasting, 3 hours of fasting before bed, 5 to 6 nights a week. And the other group stayed the same, they had the same cancer therapies. The women that followed the time-restricted eating had a 36% decreased risk of recurrence of their cancer. This is powerful, absolutely powerful. And at the same time, those women, as they were studied, had less reflux, better sleep, lower inflammation, better cholesterol, and lower blood sugar. Not changing what they ate, changing when they ate. Turning the gut off at night is very healthy for us. And I'll just tell you, there was one of my daughter's friend's father told me one time that girls, there's nothing good that happens for them after midnight, especially the teenage girls. And for us as human beings, there's very few things that we eat after dinner that are really good for us. You know, it's some chips and it's a beer and it's ice cream. It's not that you can't ever have that. It's just really not much benefit. So we know that this time-restricted eating makes a big difference. Exercise, too, is tremendous for our brain. 20 minutes most days of aerobic exercise, resistance exercise, 2 or 3 days weekly, significantly improves brain health and the way our brain ages. In particular, it improves insulin resistance and lowers blood sugar. It lowers inflammation. It increases BDNF, and that's the brain-derived neurotrophic factor, and it increases the size of that brain structure called the hippocampus that is so vital in storage and retrieval of memory. This is a study in the Journal of Neuroscience that talks about just exercising people for 6 weeks improve their cognitive function, improve their brain-derived neurotrophic factor, BDNF. This is a study in JAMA that showed that brain-derived neurotrophic factor protects against the occurrence of dementia. So now we know that clearly that food, when you eat, what you eat, makes a difference in 2018 on cognitive decline. We know that exercise does, and we know that things that increase brain-derived neurotrophic factor is another one of those buckshots that helps us preserve our brain function. And the brain is sensitive too, and this gets to the toxins. Toxins, sleep, stress, and really I should have trauma on there too. And it can be physical trauma like football, or falling off your bike when you were a kid, or your mini bike, or it can be emotional trauma too, by the way. There are things called dementogens, things that enhance or increase the likelihood of dementia. Antihistamines, Zyrtec and Benadryl. People are using Benadryl to sleep at night, you want to rethink that. If you're using Zyrtec every day for your allergies, you're going to want to rethink that. These increase cognitive decline as we age. Benzodiazepines like Valium and Ativan, if you're using those frequently, it increases cognitive decline. Painkillers, opiates, increase cognitive decline. The PPIs, the purple pill, likely increase cognitive decline by decreasing vitamin B12 that's vital to the brain and decreasing other minerals like magnesium. Statins that are used for cholesterol, and I don't want people to stop a statin or cholesterol medication based on this talk, but if you can lower your cholesterol with exercise and with diet, you're a whole lot better off than taking it, because we know the statins affect the energy metabolism in the brain. General anesthetics, and I read an article this morning at 5:30 a.m. because I always read at that time in the morning, and people that have had, looked at a group of people who had knee replacements versus a group that did not. And the people that had the general anesthesia related to the knee replacement had significant cognitive decline over the next 4 years. Doesn't mean you never have general anesthesia. If you need to have your appendix out, you get it out. But if you can talk to the doctor about local or spinal anesthesia, you want to think about that. Mercury and lead is a toxin. And molds have mycotoxins that aerosolize, that get into our air and affect our function of our brain. If you have mold in your house, you want to mitigate that. You want to remove it carefully. Now sleep, now we're on to another lifestyle factor that we know makes a difference. It's refreshing for the brain for sure. 7 to 9 hours of sleep is what most of us need. And what sleep does in the brain, and we've just really uncovered this over the last several years, is sleep helps us clean out, kind of sweep the streets of the brain. Now remember how the amyloid accumulates between the brain cells, those plaques, sticky protein between the brain cells. You know what lymph is. Lymph is these vessels that bring back edema and help clean out the tissues. Well, there's glymph in the brain, and sleep turns on the glymph. The brain cells actually shrink in size a little bit at night. Those glymph channels open, and you sweep out the debris, okay, including the amyloid. Sleep is critical for good brain health. Stress. Chronic stress leads to increased cortisol, which is the major stress hormone. Cortisol, the major stress hormone, shrinks that hippocampus, that structure in the midbrain that retrieves and stores our memories. According to this study in the Journal of Human Neuroscience, yoga and meditation in mind-body health also improves brain health. It increases BDNF, that brain-derived neurotrophic factor, kind of the miracle grow for the brain.
It normalizes cortisol and enhances the cortisol awakening response. And it improves inflammatory marker expression. Clearly, very clearly, that stress modification and meditation improves brain health.
And then there's brain training. So we're working down this list, and we know that keeping your brain active makes a difference. And Brain HQ is the very best and the most tested brain education, brain training site on the web. It costs maybe $100 a year. You want to do it about 20 minutes, 3 days a week, or more if you like it. Over 130 papers. This is from the University of Indiana, and they found when they followed 2,800 people that there was a 29% decrease in Alzheimer's disease in the people who did the brain training over 10 years. When you stimulate, when you stress, when you work the brain, you're going to improve. You're going to improve the function of the brain. Just like when you work your muscles, you turn on factors that help it grow, that help it repair. Now, these are the labs that you might have your doctor do. These look at things like inflammation. They look at things like cholesterol and blood sugar and hormones. And these are optimal levels. I won't speak to these specifically. These are the supplements. These are foundational supplements for people that want to keep their brain healthy. You may not want to take all of these, but they make sense for, I think, many people. A multivitamin, an omega-3 oil, to take, unless you're eating fish 2 or 3 days a week. Vitamin D, curcumin, which comes from the anti-inflammatory spice turmeric, magnesium, and coenzyme Q10, which improves the energy utilization and function in the brain. Now, for people that already have some brain-related issues, we add some other supplements, like PQQ and citicoline and resveratrol that comes from red wine. And then a couple of wonderful herbs called ashwagandha and bacopa that come from India, and a mushroom called lion's mane, and this interesting whole coffee fruit extract that increases BDNF. So vitamin D is very common, deficiency is. But vitamin D is important because it stimulates brain cell growth. And it activates the neurotransmitters in the brain. Low vitamin D increases dementia. Showed us that if your vitamin D level was less than 20, you had a 70% increased risk of dementia. If it was less than 10, a greater than 100% risk. This is an easy blood test for you to have done with your doctor. Very important. The omega-3 oils that come from fish we know are good for our heart. They lower our triglycerides. They lower inflammation in our body and brain. They improve cognition. You know, children whose mother took fish oils during pregnancy had a higher IQ at age 5, 6 to 7 points higher. But omega-3s also increase BDNF, the brain-derived neurotrophic factor, to take. Magnesium is very important. It's lower in people that are on diuretics. It's lower in people that are on the PPIs because the PPIs make it so we don't absorb our minerals. It's essential for nerve cell messaging, and it improves blood sugar. Magnesium lowers blood pressure, which is good to prevent strokes. And we like magnesium threonate, which is the best magnesium for the brain. Curcumin, have you heard of this? Yeah. So curcumin comes from the spice turmeric. In India, where they use lots of curry and lots of turmeric, they have the lowest incidence of Alzheimer's on our planet. It is anti-inflammatory. It's studied to be an anti-tumor agent. It's an antioxidant. It lowers cholesterol. It binds copper, which is a brain toxin. It increases BDNF. It decreases the accumulation of amyloid protein. And it's very safe. This is a study where they took people without brain health issues, and they put them on curcumin from turmeric, daily for 18 months. And then they check their brain size and they check their brain function. These people without Alzheimer's disease actually had an improvement in their brain function and a slight improvement in the size of that hippocampus. Ashwagandha is an important herb that's great for stress. It increases the clearance of beta amyloid, the amyloid protein. Bacopa is another interesting herb from Ayurvedic medicine. It's been used for hundreds, if not thousands of years. It's an antioxidant, and it increases the neurotransmitter acetylcholine that's low in Alzheimer's disease. It protects neurons from amyloid. These are the kind of things that we might be using in people that have trouble already. PQQ is a new B vitamin that we just kind of learned about. And PQQ rejuvenates energy inside the brain through the mitochondria in the brain cells. And the last one, and we're just at the end of the talk here, folks, whole coffee fruit extract has been shown to double BDNF in people at 100 milligrams daily, to double the brain-derived neurotrophic factor. There's a couple of books I would recommend for you. The first one is Dr. Bredeson's book, The End of Alzheimer's Disease. Dr. Bredeson was the author of the paper that I showed you. He's an excellent physician and researcher. It's a terrific book. It's kind of complicated, though, I will tell you that. And the second book that I think is maybe a better book to start with is The Better Brain Solution by Dr. Masley. Fabulous book. So, as we wrap up here, there's 160 million people projected to have Alzheimer's disease in this planet and world of ours by 2050. That's a lot. If we can push back Alzheimer's disease by 1 year in the people on our planet, or the people in Jeff City by doing these kind of things, we're going to decrease Alzheimer's disease by about 5 to 7%. Because Alzheimer's disease is a disease primarily of the elderly, and if we can keep the brain aging better as we get older, we're less likely to have it. And if we can push Alzheimer's disease back by 5 years, we can decrease, by 5 years, we can decrease the amount of Alzheimer's on the planet by about a third, by about 50 million people. So this is a big deal. The silver buckshot approach has been shown to do this, the slow cognitive decline. And this is that, the brain healthy diet, avoid toxins, brain boosting lifestyle. It means exercise the brain and the body, optimize labs, talk to your doctor about the labs and the hormones potentially, and supplement your brain. So this is Alzheimer's disease lecture. It's the beginning of the end, and this is the end of the lecture.